All right, Dr. Amy Proman, we're so appreciative for all the courses that you teach for us. This next one is on penile rehabilitation and practice, tools, techniques, and patient education. Tell us a little bit about that.
Absolutely. Well, I'm happy to be back and ready to attack, Rachel. So, when I think about penile rehabilitation, I think it's one of the most important conversations we can have with men, like full stop. There are lots of things that we do to our male patients when it comes to treating them for different types of cancers, for example. And I'm not saying we shouldn't do that. Obviously, we should treat men who have prostate cancer and who have bladder cancer and other types of pelvic surgeries. But the reality is, we cannot just, close our eyes and say that there are not impacts to the genitals when we do those types of surgeries. And even more than that, our patients who have long-standing erectile dysfunction, they're going to notice changes in their erectile tissue. And we can't just tell our patients, well, Bob, Jose, Juan, you're not 19 anymore. This is the body that you currently have, when we can actually do something about it. So during this course, we are going to take a deep dive. I'm going to give you a master class in the penile rehabilitation strategies that are evidence-based, that can help our patients regain not only some of that sexual function, but the genital size, right? Length and girth that they used to have that they may no longer have.
Yeah, I mean, that is something that rarely gets taught about. So I'm super excited about that. Can you give us again like a little teaser of what one of those therapies would be?
Absolutely. So often we tell our patients when we talk about penis pump therapy, oh, go on Amazon or go to an adult sex store and just purchase whatever product. The reality is our patients are going to get the cheapest one or the most expensive, and they're going to be unhappy either way. So I'll give you some recommendations for some of the products that I like to recommend for patients that they've had success with. And the key thing here, I have so many guys that come in and they say, I used a penis pump, it didn't work, or it was painful. Folks, people that say the pump is painful, it's because they're doing too much suction all at once. All right. So, what I recommend patients do, instead of just going to town on that manual lever or going to town on that battery powered button, is take a break. Hold that button down for 2 or 3 seconds, or do that manual pumping for 2 or 3 pumps. Relax, let blood go into the penis, then do it again. When people do that on off sort of maneuver or technique, they do not have pain. And penis pumps work. People just need to know how to actually use them. So I am going to teach you what you need to know to then teach your patients.
You just get me excited about every topic. All right. Well, looking forward to it, and we'll see you then.
See you then.